Every day, people sit across from me and tell me the same thing. I walk every day, 30 minutes, sometimes more, and yet they're dealing with knee pain, tight hips, numbness in their legs, chronic fatigue, a sense that their body is getting worse instead of better. The first question I ask is always simple. How are you walking? Because the problem is rarely that people walk too little. The problem is that they walk incorrectly. And walking the wrong way doesn't just reduce the benefits, it actively stresses your joints, disrupts your posture, strains your cardiovascular system, and contributes to chronic inflammation. After years of seeing this pattern repeat itself, I can tell you this clearly. Walking after 50 is not optional for health, but it must be done correctly. Let's start with why walking becomes medically important after 50. Because after 50, predictable changes begin to happen inside your body. The first is muscle loss. This process is called sarcopenia, the gradual decline in muscle mass with age. After 50, you lose roughly 1 to 2% of your muscle mass per year. That might sound small, but over a decade, that can mean losing 15 to 20% of your total muscle. And muscle is not just about strength. Muscle stabilizes joints. Muscle helps regulate blood sugar. Muscle supports posture. Muscle protects your balance. When muscle mass declines, everything else begins to weaken. The second major change is joint stiffness. Cartilage, the smooth tissue covering the ends of bones, has no direct blood supply. It receives nutrients only through movement. When you move a joint, synovial fluid circulates inside it, delivering nutrients to the cartilage. When you don't move enough, or move poorly, cartilage slowly thins. Over time, that thinning becomes osteoarthritis. The third change is metabolic slowdown. Your basal metabolic rate drops gradually with age. The same habits that maintained your weight at 30 can lead to weight gain at 55. Not because you changed, but because your body did. The fourth change is circulation. Blood vessels lose elasticity. Peripheral circulation declines. That's why many people over 50 experience cold feet, leg heaviness, or nighttime cramps. Now here's the important part. Walking addresses all four systems simultaneously. It activates muscle, it nourishes joints, it supports metabolism, it improves circulation. Research consistently shows that regular walking reduces risk of cardiovascular disease, type 2 diabetes, osteoporosis, and cognitive decline. But, and this is crucial, it only works when done properly. Let's go through the most common mistakes. Mistake number 1. Starting too fast. Many people step outside and immediately walk at full pace. But your body is not a machine you switch on. When you start too fast, 3 things happen. Your muscles are cold and less elastic, increasing microtears. Your joints are not yet lubricated, meaning cartilage absorbs impact without protection. Your heart rate spikes abruptly, stressing blood vessels that are already less elastic with age. The solution is simple. The first 3 to 5 minutes of every walk should be deliberately slow. Think of it as preparation, not wasted time. After 5 minutes, your joints are lubricated, your muscles are warm, and your cardiovascular system is ready. Mistake number 2, poor posture. Watch people walking and you'll notice it immediately. Head forward, shoulders rounded, eyes down. An adult head weighs around 10 to 12 pounds. When it moves forward even an inch, the strain on the neck muscles multiplies. At 2 inches forward, the load on the cervical spine can increase 4 to 5 times. Walk like that for 30 minutes, and chronic neck and shoulder pain becomes inevitable. Poor posture also compresses the chest. That limits lung expansion and reduces oxygen intake. You end up walking longer but feeling more exhausted. It also disrupts spinal alignment, shifting load into the lower back and knees. The correction is straightforward. Imagine a string gently lifting the top of your head upward. Relax your shoulders slightly back. Keep your chin level. Look ahead, not down. Small posture changes produce enormous long-term benefits. Mistake number 3, worn out or improper shoes. After 50, the natural fat pads on the soles of your feet thin out. Those pads act as shock absorbers. If your shoes don't compensate, impact travels straight up the chain. Ankles, knees, hips, spine. Foot arches also weaken with age. When arches collapse, knee and hip alignment shifts. That increases joint stress. Good walking shoes need adequate cushioning, proper arch support, a flexible forefoot, and they need to be replaced regularly. Even if the outside looks fine, the midsole cushioning breaks down over time. If you walk consistently, replacing shoes once a year is not excessive. It's preventive care. Mistake number 4, walking rarely but for long distances. One long weekend walk is not enough. Your body adapts to repetition, not occasional effort. 20 to 30 minutes, 5 to 6 days per week produces measurable cardiovascular and metabolic benefits. One long walk after days of inactivity simply stresses unprepared muscles. If you currently walk once a week, begin with 3 shorter walks. Gradually build frequency. Consistency drives adaptation. Mistake number 5, motionless arms. Walking is a full-body cross-coordination activity. When your left leg steps forward, your right arm should swing naturally. If your arms hang still or stay in your pockets, spinal load becomes uneven. Arm swing improves balance, rhythm, and calorie expenditure. It reduces strain on the lower back. Bend your elbows slightly. Let your arms swing naturally. No exaggeration needed, just movement. Mistake number 6, walking while staring at your phone. When your head tilts downward toward a screen, neck strain multiplies. Your chest compresses. Breathing becomes shallow. After 50, your balance system relies heavily on visual input. When your eyes are on a screen instead of the ground ahead, fall risk increases. A fall at 55 or 65 is not minor. Fractures, especially hip fractures, can lead to surgery and long recovery. Put the phone away. If you want audio, use headphones. Let walking remain a focused activity. Mistake number 7, ignoring recovery. Walking feels gentle, so people assume recovery isn't necessary. That's incorrect. Hydration matters. Even mild dehydration reduces muscle elasticity and increases cramping. Drink water after your walk. Stretch for 5 minutes. Calves, hamstrings, lower back, and take rest days. Adaptation occurs during recovery, not during exercise. 1 or 2 rest days per week is intelligent programming. Now here's the important clinical reality. The same mistakes that cause no symptoms at 30 can cause real pain at 55. Resilience declines with age. Poor mechanics that were tolerated before now create problems. Walking is one of the most accessible and powerful health tools available, but it must be done correctly. Here's your action plan. Start every walk with 3 to 5 slow minutes. Correct your posture immediately. Evaluate your shoes honestly. Aim for frequent shorter walks, not rare long ones. Let your arms move. Put your phone away. Hydrate and stretch afterward. Walking done properly supports your heart, joints, brain, and metabolic health. Walking done poorly creates strain and injury. The difference lies in small adjustments. After 50, small adjustments matter more than ever, and prevention always costs less than treatment. Start correcting these habits today.